BPD management. Early diagnosis is not that necessarily that easy. We have a lack of definitive early symptoms, variable clinical presentations of BPD. There's a reliance on oxygen requirement as a primary diagnostic marker. Difficulty in differentiating BPD from other respiratory issues in preterm infants, and all of these can lead to delayed identification and potentially missed opportunities for intervention. So this is a Scandinavian group that did this study, and this is a multi-center study of preterm infants with gestational age of 24 to 31 weeks, and clinical data present at birth were combined with spectral data of gastric aspirate samples taken at birth and analyzed using artificial intelligence. So they took this gastric acid sample, peak together with the clinical data, and they used this to design an algorithm to predict the development of BPD. Here's the diagram of what they did with this study. They didn't have many patients. They ended up having 26 babies with BPD and 35 without BPD. So they used what is called a supervised learning approach. Remember before, you probably heard from both of our lectures that there's supervised and unsupervised machine learning. Well, supervised machine learning is one where you know the diagnosis. Here, they had babies who had BPD or did not have BPD according to their definitions. And this is the particular test that they used to look at the gastric aspirate sample. They measured the peak, and the peak was the measure that they used to add to the clinical features. And the outcome was that 26 of the 61 included infants developed BPD. The spectral analysis of the gastric aspirate identified identified the most important weight numbers for classification and surfactant treatment. The birth weight and gestational age were the most important predictive clinical data, but by combining that clinical data with the spectral data, they were able to get a sensitivity of 88% and specificity of 91%. And so they thought that they had a reasonable point of care test that put together with the clinical data, they could help predict BPD. Now let's get into this, one of my favorite and unfavorite